Hello, good afternoon, everyone. We're gonna give a few minutes, so we wait for other people to join, at least a couple of minutes. So we give time enough for others to join the webinar. Okay, let's gonna start. Well, first of all, thank you for joining today. As you know, 2 weeks ago, we held a webinar on the advisory services. So for this webinar, what we are going to do is we're not going to explain carefully the advisory services, but just the application process, basically how to apply the advisory services. So if you are interested in knowing the content of the advisory services, what is in it for you, which kind of service we are providing or proposing to provide, and if you want to check which one could be more interesting for you or your organization, I would recommend you to check our website, InnoHSupport.eu, and there you will find the webinar recorded. So, and also more information about the services. But then there you can find the first webinar. For today, we have a few topics to cover. The first one is the opening and welcome. Then we will jump into a brief explanation of the advisory services and the call we have open right now. And then we will jump into the content of this webinar, the call documents, the application process, timeline, requirements, and evaluation. And then in the last time slot, we will give you some time for questions and answers in case you want to comment or say something, or if you have any doubt or any queries to solve. Before starting, just some housekeeping rules. First of all, as you know, the webinar is being recorded. We will circulate this webinar once it finishes. In 2 ways, we're going to send you a mail with a link to the website in which you will find this recorded webinar. So if you want to share this webinar with someone within your organization, or if you want to check the information again at any point, you can access this link and you will be able to see it again. As you know, and as you see, the microphones are muted and will remain muted for the rest of the meeting. If at any point you want to comment something, or if you want to make a question or whatever, there is a chat box in the options, so you can type your question there. But also at the end of the session, we will give you the floor if you ask for it. I think there is an option if you click in your bar to ask for permission to talk. So you just have to click on this, and we'll give you permission. But as we were saying, if you want to intervene at some point, share your thoughts or any questions in this chat box, and we will address them by the end of the session. Let's gonna start with the call for advisory services. Just a brief overview of the advisory services. As you know, right now we are conducting this call that is gonna be for the 3 first advisory services. There is another call starting in April that will be for the other 3. These first 3 services are especially thought for organizations that are not so mature in terms of public procurement of innovation. And the advisory services we are going to cover are the strategy planning of the organization, the unmet needs identification, and the open market consultation. The other call that is starting in April will cover, so to say, the 3 next steps after these steps. The beneficiaries of this call have to be groups of more than 3 professionals from healthcare organizations. This is public hospitals, private hospitals, nursing homes, and so on. There is a list of these beneficiaries in our website that you can find in clicking on the link. Yeah. So what are the benefits of the selected participants? Basically, they are going through a course of 26 weeks in which they will become familiar with innovation procurement processes and demand-driven innovation. So they will be able, after the course, to implement this knowledge and these learnings into their organizations, basically to strategically adopt innovative solutions that meet healthcare needs, but also to gain skills to recognize and meet needs and turn these, let's say, more abstract needs into something tangible for the organization, which in turn will become improvement opportunities and will help you to foster better outcomes in patient care. Also, you will enhance your ability to clearly communicate your needs and identify innovative suppliers in the market capable of addressing those needs. And you will benefit from clear and accessible tender documentation to conduct your own public procurement of innovation, making it easier for inexperienced suppliers to engage and compete for the challenge that you are going to pose if you are selected as a beneficiary of these advisory services. The methodology of these advisory services, as I was explaining, this will last 26 weeks, ranging from April 1st until the end of September or mid-September. The first step, which is called step 0, is not in this slide, but will consist on the presentation of a particular coach that will be assigned to your team and that will be devoted to your team. This coach is the one that is going to provide the support throughout the whole process. And each team will have a different coach, of course. So the different steps, as you can see in the image, the first step is a collaborative kickoff in which the organizations that have been selected as beneficiaries will have a meeting in which they will share what they are looking for, what is their experience on public procurement of innovation, if they have already identified needs, if they had rolled out a strategic plan, and so on. In the second one, we will conduct an individual consultation, which means that each team will have to fulfill a questionnaire, and then we have a meeting with their coach so they can assess the maturity level, the status of their ideas, and so on in regards to the public procurement of innovation. Then we will have a group session in which we will provide some training materials and some documents and resources so the teams can start preparing in the theoretical aspect what they are going to do in the planning phase. In the step 4, the teams will have to create and define a timeline a planning with a timeline, deadlines, and resources that they are going to commit to allocate to this planning. Then the consultant will check this planning. And once they agree on some changes, this planning will be accepted and the teams will work on this planning for the rest of the service. In the step 5, the different teams will start conducting this plan. They will have always the guidance support of the coach. They will have regular meetings, but also depending on the teams, if they need more support, they can ask for more support on demand. And also there is the possibility of involving some external experts from a group of experts that we will create in the next weeks. So the participants can have the tailored support of an expert on some of the topics that they are going to have to work on. Then starting on the week 15th and taking place at the same time, overlapping with the individual support, we will have the collaborative exchange, which is basically a way of put together the different teams that are beneficiaries of this call, so they can share knowledge, information, lessons learned, their goals, objectives, what they have thought to solve this problem or that problem or this challenge. And we will try to find synergies. So in case that some other team is also working on something similar, you will have their support and you will have the possibility to talk to them and find these kind of synergies. And finally, in the step 7, the reporting and evaluation, during the last 2 weeks of the course, you will have to fulfill some information and you will have to report this document or this deliverable to your coach. Now let's gonna jump into the call documents. This is the administrative part and the more formal part of the process. As you know, there are 4 different documents. The first one that is called Annex 0 is the guidance for applicants. This is the document that you must read if you want to apply to the call. In this document, everything is explained, the different advisory services, the content you are going to find, the evaluation criteria, the requirements, the kind of beneficiary we're looking for, also the selection process, how the application process is going to work, the different the timeline for the different stages. So if you have any question or any doubt, probably the information you're looking for is in this document. But if it's not, of course, you can always drop us a mail. I will share with you later on an email address to drop your questions. And then for the application process, you have to fulfill 3 different documents. The first one is an administrative form in which you will have to include basic information like your job title, your name, your organization, if it's a private or a public hospital, and so on. This is pretty straightforward. And then you have another annex that, depending on the service you are applying for, is a different document. So there are 3 different documents. You will have to fulfill just the one of the service you are interested in participating. This is probably the most time-consuming document that you have to fulfill, because here you have to provide information about your organization, what are you going to do, what are your plans, what is your previous experience with the service you are applying to. If you don't have an experience, which participants do you have, which roles they have, and so on. Probably this document is something that you need to download, discuss internally, and probably fulfill and iterate sometimes. So if you have to start from something, I would recommend you to start fulfilling this document, because it's going to take probably some time. And finally, we have the commitment letter, which is a document just to ensure that we are all on the same page when it comes to the commitment that you need to provide for this service. It's a very short document. It's a commitment letter in which you are committing yourselves to allocate a certain number of time to this service, to say that your organization is aware of you doing this, and that they are going to give you this time to work on the services. It's very well explained and it's very straightforward, but if you have any doubt, you can contact us. And finally, once you have these 3 documents fulfilled, you will have to submit this information through the InnoHSupport platform. You have a link later on in this presentation, but also on the website. And something that I haven't mentioned is that as a team, you can apply up to the 3 services. I mean, you don't have to choose one service, but you will be granted just one of them. So you can apply to the 3 of them. You will have to fulfill the 3 different proposal templates, but then you will be rewarded only with the, I mean, you will be granted with just one of the services. Who can apply to this call? Those are the 4 main actors that we are looking for: public and private hospitals, nursing homes and rehabilitation centers, and public health departments. But also we are thinking about other healthcare providers. So if you have also any doubt, you can drop us a question in the mailing. And this is important, we are looking for multidisciplinary teams, which means a group of 3 or more professionals from the same organization. Then, when it comes to the application process, there are 4 steps. The first one is, as I was saying, to download the guidelines and the different documents and read them carefully. You can find these documents in this link in our website. Then, if something comes up, any doubt, any query, something that you would like to clear or to solve, you can ask us, sending a mail to this mail address. We will try to address your question as soon as possible. Then you will have to fill in the documents. Probably this will require some time from your side, because these kind of documents need from some reflection and to check information again with other people and iterate this document. So this is probably the most difficult part. And then finally, once the documents are filled, you will have to submit them through the InnoHSupport platform. How to apply is very straightforward as well. You have to, first of all, as I was saying, complete the proposal, then fill in the administrative form, and finally sign the commitment letter and submit everything to the InnoHSupport platform. If you have any questions or queries, this is the mail address that we are using for solving them. So you can use it at any time. I will share it also in the chat after the presentation. Then finally, the evaluation process. First of all, we will do an eligibility check, which means that we're going to check if your organization and your application is meeting with all the criteria that is included in the requirements. If you do, we will go to the step 2, and if you don't, we will let you know so you can, I mean, if it's something that you can solve in the short term, we will let you know so you can solve the problem or make a decision based on our feedback. Then during the step 2 that will take place in March, we're going to do a remote evaluation. We're going to have a selection committee of experts. I think that we are 7 experts. So this group of experts, at least 2 people will check your application, and each one of them is going to develop a different summary. Then with those summaries, we're going to check your score compared to the others, and the organizations or the teams participating with the more score, I mean, with the highest score, will be rewarded with the process. You will receive this summary of the evaluation, so you can make any comments if you wanna, I don't know, ask for the sake of transparency for more information or whatever. So at this step, you will receive this summary. Then, as I was saying, with this score, we will do a preliminary ranking and communication of result selection. You will have this time to appeal. And finally, by the end of the month, beginning of April, we will communicate the winners in our website. As I was saying, the evaluation committee will be composed of 7 experts, internal from the InnoHSupport consortium. And the evaluation criteria we're going to use to evaluate the proposals is divided into these three different categories: feasibility, team commitment, and adoption willingness. If you check the annex number 2, the proposal template, depending on the service, these different criteria will be aligned with some different requirements, let's say, or some different criteria. You can check the information there if you wanna know what are we gonna assess in detail, and also you can check the guidelines if you are looking for the details on this. Finally, just to give you some dates and the timeline of what we are gonna do. As you know, the call for advisory services is open right now and will be closing 1 month time, I think, because yeah, it's closing on the 20th of February. Then the eligibility check will take place since the 3rd of March until the 10th of March. The evaluation of the proposals will take 2 weeks, from Tuesday, the 11th of March until the 25th of March. And finally, the final ranking publication will take place on the 1st of April. Here, this is just to give you an overview of what we were saying. First of all, read the documents, check them carefully. If any doubt or any question or something comes up, you can send us a mail. We will try to solve as many questions as possible and as soon as possible as well. And once you have everything clear, you should start filling in the documents. And once everything has been iterated and set it internally as many times as needed, you can submit it through the EU-Survey portal. As we were saying, if at any point of the process you have a question, you can always drop us a mail here and we will try to solve it as soon as possible. And that's all from my side. Now I think we have the turn for questions and answers. So if you have any question, you can just drop your question in the chat box, or you can even ask for the floor so you can say it directly. Okay, I don't see any questions so far. Okay, I think that if there are no questions, we can close the session. And if you have any questions, you can always send us a mail to this email address. I'm gonna try to copy paste it here. Just one moment. Okay, so here in the chat box, you should have the email address. So if you have any question at any point, just send us a mail. And that's all. I think we have something. Okay. Why we have a question from John De Giorgio. Why did you opt for this approach rather than a call for tender? What do you mean? Could you mind? I'm gonna give you the floor. So if you can elaborate a little bit on this question, it would be great.
Hi, good afternoon.
Good afternoon.
Thank you for your presentation. Usually, when we have these type of calls, we adopt a normal approach, a call for tender. We, in the specificate, in the terms of reference, we list what we are looking for. And obviously, we can have also a session with the economic operators, those who might offer their services, and we adopt that approach. I don't know if how it falls like innovation procurement. That's my request, my question about how do you consider it as innovative?
Yeah, okay. The thing is that we are not providing, let's say, we are not giving money to do the public procurement. I mean, we are not buying the product. We are giving a service for the teams of healthcare organizations to conduct this process. We're doing some capacitation to these teams. So probably what you mean is that why we are not doing this through the normal tender process, but because this is not a tender, this is just to give the service to healthcare organizations, but not to conduct the process of the public procurement of innovation. Is that what you meant? Sorry.
Yes, basically that. Okay, all right. Perhaps can understand better your approach. All right, okay, it's okay.
Okay. Anyway, if you want to check the in the website, you will find a description of the advisory services, and also in the previous webinar we held 2 weeks ago, there is quite well explained all these things. So just probably to avoid any misunderstanding, there you may find something.
Okay.
Okay. Thank you for the
Because
question.
you know what I really understand by innovations, that's something that is not yet available in the market. That's how we usually I recognize if something is innovative. If it's procurement for innovation, that's my understanding. So that's why I asked this question.
Yeah. Yeah, I agree. But what we are doing here is to help healthcare organizations teams to identify the innovation.
Okay.
How they
Yes,
can
yes.
introduce the innovation in the process.
Okay. Thank you
Okay.
very much. Thank you.
You're welcome. Okay, so if there are no more questions, I think we can close the session now. We will send you a mail as a follow-up after this, after the meeting, and also we will upload this webinar to the website. So if you want to check or if you want to see something, you will find it there. Thank you for joining and have a good afternoon. Bye-bye.